Blood groups and blood typing are the topics of this screencast. These topics may be found in Chapter 10 of your textbook. This screencast was designed to achieve the following objectives: explain why blood transfusions are performed, describe the ABO and RH blood groups, explain how blood typing is performed, identify the blood type of a sample based on the presence or absence of agglutination, determine the compatibility of donor and recipient blood types, explain why the RH blood group of the mother and father are important when considering pregnancy, and lastly, define hemolytic disease of the newborn. Oh, one more. Explain cross-matching. You learned in a previous screencast that there can be serious consequences for sudden, large losses of blood. If you suddenly lose 10% of your blood volume, say you give a pint of blood, that loss will slightly decrease blood pressure. That can cause you to become fatigued. You may have generalized weakness. You may even faint. However, the effects are pretty acute, very short term, and within 24 hours, blood volume and pressure are restored, and within a month, any red blood cells that were lost are replaced. So there are no long-term ill consequences for such a small loss of blood, even if it is over a very short period of time. However, a large loss, over 30% loss of blood volume, will drop blood pressure to such a low level that the cardiovascular system is unable to maintain blood flow to all necessary tissues and organs of the body, and death is imminent. In that situation, the only way to replace the blood that was lost quickly and restore blood pressure is through a transfusion, where donated blood is intravenously introduced to the recipient through their veins. When delivering donated blood to a recipient, the compatibility of the donor blood and the recipient blood must be considered. If a patient is transfused with incompatible blood, antibodies from the patient will attack the erythrocytes of the donor blood. This causes them to clump up, as illustrated at the bottom of your screen. The clumping of the erythrocytes with the antibodies clogs small arteries, cutting off blood flow to organs, causing those organs to fail, and ultimately putting the life of the recipient in jeopardy. When erythrocytes are destroyed by those antibodies, as they eventually will be, the hemoglobin is released into the blood. The kidneys will attempt to clear the hemoglobin from the blood, but ultimately they will be overwhelmed and kidney failure will occur. So it is critically important to ensure that donor blood is compatible with the recipient's blood. So it's important to assess the blood types of the donor and the recipient before attempting a transfusion. Blood cells, like all cells, contain glycoproteins embedded in the plasma membrane that act as antigens. Antigens are used by the immune system to determine if a cell belongs to the body or if it is foreign. If an antigen is foreign, an immune response will be mounted against the cell will be attacked and likely destroyed. On the other hand, if the antigen is recognized as self, then the cell will be left alone. Self-antigens prevent the immune system from attacking the cells of the body. So these glycoproteins embedded in the plasma membrane of red blood cells allow the immune system to determine if the cell belongs to the body or if it is foreign. So when considering transfusing a patient with donor blood, we have to consider the types of antigens on both the recipient's blood cells and the donor's red blood cells. There are over 30 common red blood cell antigens. However, the most vigorous transfusion reactions are caused by antigens of just two groups, the ABO group and the RH blood group. Let's first discuss the ABO blood group. The ABO blood group is based on the presence or absence of two antigens. If your red blood cells have the A antigen, then your blood type is A. If your red blood cells have the B antigen, then your blood type is B. If your red blood cells have both the A and the B antigens, then you have type AB blood. If your red blood cells contain neither A nor B antigens, then your blood type is O. The immune system produces antibodies after being exposed to an antigen. This is the principle that is used in vaccinations. So you expose the body, the immune system, to a dead germ or a germ that is incapable of causing disease. The antigens on the germ cause the immune system to produce antibodies, so that if you're ever exposed to the disease-causing germ again, if it invades the body, there's a supply of antibodies that can clear the germ from your body before it is capable of causing illness. Within months after birth, the immune system begins producing antibodies against antigens that are not present on your red blood cells. So if you are type A, your immune system produces anti-B antibodies. These are antibodies that will attack the B antigen. If you are type B, your body will produce anti-A antibodies. These are antibodies that will attack the A antigen. If you are AB, because you have both the A and the B antigens, your immune system will neither produce anti-A nor anti-B antigens. If it produced either, you would have an autoimmune disease and your immune system would destroy your own red blood cells. If you are O, what kind of antibodies do you think your immune system will produce? Well, if you're O, you contain neither the A antigen nor the B antigen. Therefore, your body will produce antibodies against both A and B, anti-A and anti-B antibodies. So in a previous slide, I said that you have to be exposed to an antigen in order for your immune system to develop antibodies against that antigen. So how does your body, your immune system, produce antibodies against an antigen of a foreign blood group if you haven't been exposed to foreign blood? Well, it turns out that antigens of the ABO blood group are also present in bacteria. They're present in some of the foods that we eat, and they're also present in other substances in our environment. So we are exposed to these antigens in our environment, and that is why we develop antibodies for antigens of the ABO blood group that are not already in our blood. So essentially, we are vaccinated against other blood groups within weeks of birth. When we are considering a blood transfusion, it is the antibodies of the recipient that determine the blood type of the donor. Let me say that again, because sometimes students have difficulty understanding this. It is the antibodies of the recipient that determines the blood type of the donor. Going back to this figure, someone with type A blood, they have anti-B antibodies. Can they receive blood for someone with type B blood? No, because the anti-B antibodies will attack those blood cells. Can they receive blood from someone with AB blood? Again, the answer is no, because they have anti-B antibodies and they will attack the B antigen on the blood cells of an AB blood donor. So patients with A blood can receive type A blood and they can receive type O blood. Type O blood does not have the B antigen, so they would not be attacked by the anti-B antibodies of a recipient with type A blood. What about someone with type B blood? They have anti-A antibodies. They could not receive blood from a type A donor. They could not receive blood from a type AB donor. They could only receive blood from other B and also from O. What about someone with AB blood? Who could they receive blood from? Well, they do not have anti-A antibodies. They do not have anti-B antibodies. So they could receive blood from type A, type B, type AB, or O donors. That is why someone with type AB blood is referred to as a universal recipient. What about someone with type O? Someone with type O has both anti-A antibodies and anti-B antibodies. Could they receive blood from a donor with A blood? No, because their antibodies would attack the A antigen. What about B? No, they have anti-B antibodies that would attack the B antigen. And certainly they could not receive blood from a donor with type AB blood. They could only receive blood from someone with type O blood. However, notice that because there are no A antigens or B antigens on a red blood cell for someone with type O blood, that someone with type O blood could donate blood to all of the other blood groups, to someone with A, B, or AB. And for that reason, people with type O blood are referred to as universal donors. So obviously, when considering a blood transfusion, it is critically important to determine the blood type of both the donor as well as the recipient to ensure that the patient's blood will be compatible with the donor's blood. For that, we can use the specificity of antibodies. So antibodies are very specific. The anti-A antibodies will only bind to the A antigen. Anti-B antibodies will only bind to the B antigen. So we can use them like probes. So in typing blood, we will take a sample of blood and we'll mix that blood with serum containing anti-A antibodies and serum containing anti-B antibodies. In this example at the bottom, here we have an unknown sample of blood. It happens to be type A, but let's say we don't know that. If we take that unknown sample of blood and we mix it with anti-A serum, that serum containing the anti-A antibodies. If we mix the anti-A serum and the blood sample together, the antibodies will bind to the antigens on several red blood cells, producing clumping, or what's also called agglutination. And that would tell us that there were definitely A antigens present. We would then mix a second sample of blood from the same individual with anti-B serum, trying to determine if there were B antigen present. And the result of that mixing would tell us whether this sample of blood was A or AB. So now that you understand that we can use antibodies like probes to determine if a sample of blood contains specific antibodies, let's type some blood. So we take 2 samples of blood from the first individual and we mix one sample with the anti-A serum, and we take the second sample and mix it with the anti-B serum. In both cases, we got clumping or agglutination. That means that the antibodies found their antigens. The anti-A antibodies found A antigen, and the anti-B antibodies found B antigen. Therefore, this first individual has what type of blood? If you said AB, you are correct, because both antigens are present as revealed by the agglutination that occurred when we mixed anti-A antibodies and anti-B antibodies with samples from this individual. We take blood samples from a second individual and again mix it with anti-A serum and anti-B serum. Notice we had no agglutination when we mixed the sample with the anti-A serum. Therefore, there are no A antibodies, no A antigen present in the sample. In the second sample from the individual, we got agglutination when we mixed it with anti-B serum. That means that there are anti-B antibodies present. Therefore, this individual is what blood type? Type B. You are correct. We take samples from a third individual and we mix them with anti-A serum, anti-B serum. Notice we got clumping when we mixed it with the anti-A serum. That means that there's A antigen present. We got no clumping when we mixed the second sample, with the anti-B antibodies. That means this individual is what blood type? Type A. You are correct. Now we take samples from our last individual and we mix samples from our last individual with anti-A serum, anti-B serum. In both cases, we failed to see any agglutination. That means there's no A antigen present, no B antigen present in the blood samples. Therefore, this individual is what blood type? Type O. You are correct. So now that you have a good understanding of the ABO blood group, let's now talk about the RH blood group, because this blood group is also responsible for the most vigorous transfusion rejections. So this blood group is named for the presence or absence of one of 8 RH antigens, the agglutinogen D antigen specifically. So these antigens were originally identified on rhesus monkeys, and rhesus begins with the letters RH, and that's where we got the name RH blood group. So if you have the agglutinogen D present on the plasma membrane of your red blood cells, you are considered RH positive. Most Americans are RH positive. If you do not have the agglutinogen D antigen present on the plasma membrane of your red blood cells, you are RH negative. Now recall that with respect to the ABO blood group, you develop antibodies against whatever antigen is not present on your red blood cells within months after birth. That is not the case for the agglutinogen D or RH antigen, unless if you are RH negative, unless you have been exposed previously to RH positive blood or the RH antigen, you will not have antibodies against this antigen. So technically, you could be RH negative and receive once anyway, Rh positive blood without fear of rejection. Because after exposure to an antigen, it takes time for your immune system to build up antibodies. And by the time enough antibodies were produced by your immune system, most of the red blood cells will be cleared from your body. So I am A positive. If you were A negative and you'd never been exposed to positive blood before, you could receive a blood transfusion with my A positive blood once. However, you can never receive a transfusion with my A positive blood again, because once you were exposed, your immune system would create a large supply of antibodies. And if you were ever exposed to that, if you were ever transfused with A positive blood again, those antibodies would immediately attack any red blood cell that contained the Rh antigen. So now let's talk about the practical significance of this, aside from the fact that you could never receive Rh positive blood again if you had been exposed to Rh positive blood previously and you were Rh negative. So there is a potential danger during pregnancy if you have an Rh negative mother and an Rh positive father. And I should clarify, this is not a danger for the first pregnancy, but any subsequent pregnancy, there is a danger. So if you have an Rh negative mother and an Rh positive father, there is a 50 to 100% chance that the child will be Rh positive. It just really depends on if the father is homozygous or heterozygous. If he received the Rh positive antigen or gene from both parents, then there's a 100% chance that the child will be Rh positive. If the father received the Rh positive gene from one parent but not the other, then there's a 50% chance that the child will be Rh positive. So there's a 50 to 100% chance that you will have a Rh negative mother with a Rh positive child. So we have a situation in this example where the mother is Rh negative, the baby is Rh positive. At the placenta, the two blood circulations, the maternal blood circulation and the fetal blood circulation, come very close to one another, so there can be an exchange of nutrients and respiratory gases, but the two blood circulations do not normally mix. However, if there is a surgery at some time during pregnancy or during the birthing process, almost assuredly there's going to be a mixing of the two circulations. And what's going to happen? The mother is going to be exposed to the Rh positive blood of the fetus and or embryo, and the mother is going to therefore be exposed to the Rh protein, and the immune system is going to start producing antibodies. Again, this is not normally a problem with the first pregnancy. If there was a surgery very early on in pregnancy, perhaps, but in general, not a problem. However, now the mother has essentially been vaccinated against the Rh protein and will begin making large amounts, potentially large amounts of antibodies against the Rh protein. So, an Rh negative mother successfully delivers an Rh positive child, no problem. Now comes the second pregnancy. Again, the Rh negative mother is carrying an Rh positive child. The mother, since she was exposed to the Rh antigen in the previous pregnancy might have a large amount of anti-Rh antibodies circulating in her blood. These antibodies are small enough to cross the placental barrier and enter the fetal blood. And if they do, they will attack the red blood cells of the fetus. That can make the fetus to become anemic, where there's a lower than normal amount of hemoglobin and therefore oxygen in the blood. And this can cause what's called hemolytic disease of the newborn. To prevent sensitizing of a Rh negative mother in the first pregnancy, typically an injection of RhoGAM is given to block the immune response to the Rh antigen during the first pregnancy. Blood typing for the Rh blood group is performed in the same manner as that was used to determine the ABO blood group. We'll take samples of blood and mix them with anti-Rh serum. That is serum that contains antibodies against the Rh protein. If we get agglutination, we know that there's Rh antigen present and the individual is Rh positive. If we get no agglutination, that means there's no Rh antigen present in the blood sample and the individual is Rh negative. Even after we type both the ABO and Rh blood groups in both donor and recipient blood, we will perform a second procedure which is called cross-matching. Here we take a small sample of donor blood and we mix it with a larger sample of recipient blood, and we'll take a small sample of recipient blood and mix it with a larger sample of donor blood, and we'll look for clumping or agglutination. If we don't get agglutination, we conclude the two blood types are compatible. If we do get agglutination, we conclude that the two blood types are, or two blood samples are incompatible and we'll have to look for another donor. Why do you think we do cross-matching after typing both the ABO and Rh blood groups? Well, there are two reasons. First, there could have been errors made when typing the ABO and Rh groups in the donor or the recipient blood samples. Second, if you recall, I said there are about 30 different groups of antigens that are present on the red blood cells. And I said usually being the key word, the only blood groups you have to worry about are the ABO and the Rh blood groups. But that is not always the case. Potentially, the other 28 blood groups could cause rejections, transfusion rejections. So to make sure that doesn't happen, you mix both the donor and the recipient blood samples with one another and you look for agglutination. If you don't find agglutination, you can proceed with the transfusion. Now let's review the objectives of the screencast, explain why blood transfusions are performed, describe the ABO and Rh blood groups, explain how blood typing is performed, identify the blood type of a sample based on the presence or absence of agglutination, define the compatibility of donor and recipient blood types, explain why the Rh blood group of the mother and father are important when considering pregnancy, define hemolytic disease of the newborn, and explain cross-matching. We have now come to the bloody end of this module.